Hi everyone, this is a demonstration webinar for the AEGLE platform for researchers and practitioners. I am Anna Paleolog, the project coordinator of AEGLE, and I am based in Greece. I would like to have an introductory presentation of the project, a very quick one, before we go into the demonstration of the platform. Anyone who has questions in regards whatever you see today, you can ask them through the Q&A functionality or through the chat. Attendees cannot speak in this webinar, unfortunately. So let's begin. AEGLE is a project funded by the European Commission, and here are the aims and the challenges that we're facing in the project. So the project aim is quite simple. We want to improve the performance of the healthcare system, and we want to do it through providing insights from medical data after these have been processed to doctors or people who are taking important decisions in the healthcare system. The challenge is of course similar to many other projects working in the field. The data amounts are enormous, so that's not so easy to handle. There is a need for intelligence, efficient analytical engines, and we want to achieve both of the above at a reasonable price, because improving performance without reducing the healthcare costs will not be as successful as expected from our politicians. In regards to the last one, we are running at the moment a questionnaire, so please provide your inputs. We want to find out what would be a reasonable price for a system or a platform such as AEGLE. Going further, so the solution that the project offers can be summarized in this very small but powerful sentence. It's a platform for big data, medical data, with libraries of standalone analytics. For whom? As I already mentioned before, it's not only for researchers, but it is also for healthcare planners and clinical practitioners. So actually doctors who are taking important decisions every day. The researchers, of course, can test their hypotheses, generate them. The practitioners, they are called to take fast decisions, especially in circumstances like the ones of the intensive care unit. And this system is supposed to help them. And the healthcare planners would like to have a better insight into the state of the population and take advantage of some predictive analytics. We have worked with 3 featured use cases in this project. These were the intensive care unit use case, the use case for diabetes, the non-malignant chronic diseases, and the chronic hematologic malignancies. So in particular, we have worked with chronic lymphocytic leukemia.
We were very excited to participate in this project with the team of the ICU from the University Hospital of Crete. And we have actually tried to explain the problems we face in the clinical practice and our research needs to the engineers we are collaborating with. And we have tried to ask them for help to provide new solutions. And this is what you are going to see soon after this brief introduction. The main focus of the presentation of now will be on patient-ventilator interaction and how to better explore it, and personalization of patient care. Sorry about that. So, mechanical ventilation is one of the most common things in the ICU. We use it to almost all our patients, but we know that although it's a supportive measure, mechanical ventilation can kill. And So we need to improve the way we apply ventilation in practice. The reason this aim becomes complicated and we need more help doing that is that it's a continuous thing. People are breathing 30 times a minute, so throughout the day. So when we monitor ventilation, we end up with really, really big data. And to analyze that, we need big data analytics. We have focused on patient-ventilator interaction, and the ineffective efforts, which is when a patient is trying to breathe and the ventilator does not support their breath. This is feels really bad for the patient, causes discomfort, stress, but it also causes problems to the body, and it can adversely affect patient outcome. So the scientific questions and the clinical needs that arise is to identify, characterize ineffective efforts, predict their development, find out when exactly they are become really problematic, and explore how to better design alarm. So data for anything that monitors ineffective efforts can be analyzed in this platform. And I will show you in the demo how this has been built. The other polar of this presentation is the personalization of patient care. And in everyday critical care, patients are, after overcoming the first reason that brought them in the ICU, they need supportive care. And this supportive care sometimes tends to be more neglected versus the acute need that brought the patients in our care. And the one typical example of that is feeding. So nutrition in the ICU, this is the example for the research platform that we're going to give you now, is one of the very big problems in intensive care, because although we know that everybody needs to eat well, and the better you eat, the better you are, optimal nutrition in ICU is not known. There are very complicated formulas in the literature to calculate needs, but even when you calculate needs, you don't know if you should provide all those needs to the patient or some part of it. And when you want to make an analysis, you have multiple contributing parameters. And thus you would need a powerful tool to explore, for someone to explore their own data. And this is what we have asked our engineers to build, and I'm going to show you a little bit about that. Okay, so is my screen sharing okay?
Yes.
Can you see?
Yes,
okay.
Yes.
So after logging in to the platform, which will be include some security issues, and so because it's personal data that have been anonymized, and there are several things that one need to take care of so that we have actually secure and restricted access to the data we are allowed to see. And this has been very carefully taken care of in AEGLE. And then we select the ICU case for this demonstration. And here we have the platform that we are going to be working. So first, I'm going to show you how we would analyze patient ventilator interaction to see for ineffective efforts. And if we have data like coming from monitoring from patients, we could upload them, and then they would appear here under data sets. And these are the data that we have uploaded here. These are the raw data. And several anonymization formats are available. For this data, when they come from a patient and they are from prolonged recordings, they are full of artifacts, and then they need to be cleaned. So here under workflows, we have the predefined workflows, tools that are needed so that some analysis can be performed. Here, as you can see, there is the option to add custom workflows for the researcher. Under here, the patient ventilator interaction tool, we can see that a pre-analysis, the pre-cleaning step is performed. So if we generated here this analysis, we would have our data cleaned from the artifacts, and only the true values would be selected. And such results would then appear here under analysis results, where we would be able to see any file that we have created from either from this preliminary analysis. And here you can see that for these hundreds of patients I have, a pre-treated file has been created. And because at the beginning of the project, we were not actually sure what is going on in the patient and why they are having ineffective efforts, we would like to have a visual exploratory analysis. And so here in visualization, we can see these results. We can see this patient and actually do such exploratory analysis. These are time series. So I will ask for a time series. And I want to see many plots together so I can understand what is going on. And here in attribute 3, I will select ineffective efforts, and I will try to understand why this patient is having ineffective effort. And I could choose some parameters that I know they are related and see that during time, if they change together. So if I update the graph, they will, I will see here. So what you can see here is that this patient for most of the time did not, this is the number of ineffective efforts he had. So most of the time he was pretty good. He did not have many. And suddenly here something is happening. And I really don't know what happened there. Obviously the physician who was in the room did not notice that was something going on with that patient. Otherwise we wouldn't have that recording. So let's focus on this part. And we can see that clearly from 0, he went to have like 15 ineffective efforts per 30 seconds, which is quite a lot. And let's see. Here, this graph tells me that P01, that represents the patient's drive to breathe, was not constantly the cause of this behavior because it's probably flat. I do see here a quite significant increase in the obstructive parameter that's called PIP01, PIP intrinsic PIP. I don't want to make you all intensivists, but I want to show you that these visualization tools, when carefully exploring patient after patient, and this is what happens in a research project, you have to start wondering and look for what you will find. I can use these visualization tools to try to see what direction I will give to my analysis and how I will try to, what parameters I will include in a predictive model to try to find why ineffective efforts are happening. And I will not show you many of patient after patient, but I can tell you that we have performed several analyses for these patients, and we can perhaps see some analysis results here. So I will select an outcome file now of this analysis. And now I will select, for example, box plots and see parameters that were associated with outcome. And so perhaps, let's see. Let's see how survival in the hospital is different in patients who have a different ineffective effort index. Okay, so you can see that my results show that the ineffective effort index, this is what in the literature we used to use to describe ineffective efforts. There's not much different, and this is how the platform provides a visualization of your analytics of the results. And let's see the event power. This is a characteristic that we identified through this research project that is significantly different in patients who die than the patients who survive. So this is an example, perhaps I can show you one more, of how results are produced and how results are visualized in this research platform. Again, the same pattern. Duration of events is similarly just as bad as their whole power, and this different between IC survivors and non-survivors. So there are other things that we have included in this platform, and as I told you, one of the projects that we have worked on and that we think is important for the researchers in the ICU is nutrition. And here in the predefined workflows, nutrition is a parameter that comes from the data included in the electronic health record of the patient. And as I told you in the introduction, it is quite complicated to calculate the everyday or hourly needs and thus the deficits of the patients who are in the ICU. So here we have created a specialized predefined workflow that for the selected patient, it will calculate the nutrition provided and the requirements and thus the deficits. So it will create stats. And then we have also created a model that predicts patient outcome based on nutrition to explore which parameters of nutrition contribute to patient outcome. If we would run this through Generate, we would get the analysis here in analysis results. And of course, several different analyses we could have here, and here we have statisticals for nutrition, and we have a model that we have created that predicts patient outcome. And I will try to show you how that looks. And let's take an example for nutrition here. And we can try to see as a scatter plot how some continuous variables would relate. So let's say ICU stay, for example, and let's see how this is related to the deficit. Patient, how much deficit in calories the patient has accumulated over his stay in the ICU. And this, as you can see here, we get a graph created, and we can see that longer ICU stays, here we have some pretty extreme ICU stays of 100 days, but we can see that for the shorter ICU stays, there is not much correlation. So such graphs, let's see, for example, another extreme example. Let's see if we feed them more fat as a percentage, that make any difference in their ICU stay. Not really, there's not much difference. So you can see here that this is also exploratory, but we get all sorts of results for any of the parameters that we have included. And we could also consider seeing some also results in box plots. So let's see how survivors and non-survivors are different in some nutrition parameters. The idea behind that is that we have created some predictive models and we have some results identifying thresholds for nutrition. Let's see, here is progress, and let's see calories deficit. So what we have identified some thresholds that we would like to use for our team, for our population, and survivors and non-survivors have something that doesn't look like a statistical difference. But the idea behind this feature is that everyone, you wouldn't necessarily take my results to apply them in your ICU population, but you would upload your data and you would investigate in a specific patient population the thresholds for optimal nutrition. And this was the idea behind this, the build of this research user interface. So here, for example, in the workbench, you could create a data set from your own data and explore nutrition in a specific population. For example, let's say that I want to explore a specific population, the really old people in the ICU. There's been a lot of discussion about patients in the ICU, the elderly patients in the ICU, and how they do not have a good outcome, and perhaps they shouldn't even be admitted in the ICU. So let's say age 80, and I would create now such a data set. Some bug here. So I could select data sets that I would then run the workflows and calculate in a specific population. I could select anything. I could select, for example, only trauma patients based on admission diagnosis or other parameters that one would like. And then through that analytics, I would choose to find how survivors are different from non-survivors in a way, in an effort to try and understand and optimize thresholds. And next week, when we have the clinical ICU user interface, you can see that we will be able to monitor nutrition through the AEGLE user interface. And perhaps through our research, using the research user interface, we can identify the optimal nutrition thresholds we want for our patient population. And then in the clinical user interface, apply those selected thresholds and have a tool that will tell us in hour-to-hour, 8-hour basis, for every shift, that is, how our patient is, nutrition is provided based on our customized and personalized selection that we can create through this research tool. And by that, I think I have talked quite a lot.
Thank you, Katerina.
Let me just add that some of the results of our analysis that have been quite interesting, and the predictive results of the predictive analytics that have been developed are not best shown as graphs, but the platform will also provide the option of downloading the results of the analysis so that someone can actually work on spreadsheets and examine again how the predictive analytics work in your specific patient population.
I would like to mention that after this session, you will receive some notes in regards the demonstration, that you can also subscribe to watch the demonstrations on Thursday and on March 15. And you're very welcome to join us in the conference, either as a presenter or as a participant. And finally, the questionnaire that we posted just now, please give us your opinion. It is very important to have the opinion of stakeholders for estimating a correct value for the price of these difficult and complex platforms. Thank you very much. And if you need to contact us at a later stage, maybe with a question, you can do so via the email that you can find on our website, and we will get back to you. Thank you very much. Have a nice day. Bye bye.
Thank you. Bye.